of you. COVID-19 pandemic has had a major effect on our life. Many of us are facing challenges that can be stressful, overwhelming, and cause strong emotions in adults and children. It is a need of the hour to learn the stress and the measures which causes stress, both in the general public as well as amongst the healthcare professionals. To live a healthy way will make you and around you become more resilient. Parul Institute of Nursing, Parul University has taken such an effort to disperse the knowledge, impart the information to the students as well as to the nursing fraternity about the stress and the coping strategies about the COVID care. The agendas of this webinar is to understand the factors for anxiety and stress, to discuss the measures to overcome the anxiety and stress during COVID-19 treatment, to discuss the various stress techniques and therapies to reduce the stress and anxiety. So this one for COVID pandemic has bring out the stress and anxiety for the general public as well as to the healthcare professionals. In the general public is about the treatment, about the disease, mode of transmission, and the treatment protocol, prognosis, post-COVID effects, and about the options of vaccines, reducing the stigma, and the stress causes to the children and old age home and by living at home isolated, and increase the use of alcohol and substance, and loss, grief, financial loss, etc. As well as this COVID has brought a lot of stress and anxiety in the healthcare professionals also. So that is prevention and self-protection about while providing care to the nursing faculty, nursing staff, and preventive measures and precautions to be taken care while giving care, and what is the protocol in case if infected or in case if start showing the symptoms. So all these things are the stress and anxiety level in the healthcare amongst the healthcare professionals. So to speak about the stress and anxiety in detail, we have an eminent speaker, Professor Vimala G. She is working in PIMS Nursing College, Loni, Pravara, Maharashtra, and she is working as a head of the Department of Psychiatric Nursing. And she has completed her master degree in the year 2010 from Vinayaka Mission Deemed University, and pursuing PhD in 2016, since 2016. And she has vast experience in the field of nursing education, research, and administration. And she also received a first rank during her PG, and she has received various awards. Amongst that, she has received the state level first prize for her poster presentation in the year 2012. And also she has two authorship in her credit, uh, and also she has written contributed for the writing in textbook also. So that now it is a time to listen from Vimla ma'am regarding the combat stress and anxiety in COVID care. Ma'am, over to you.
Thank you, sir. Good morning to everyone. Respected Dr. Ravindra sir, Principal, Parul College of Nursing, and organizing committee for giving me an opportunity to present the topic on combat stress and anxiety in COVID care. Best wishes and greetings to all from Pravara Institute of Medical Science, Deal University, College of Nursing, Loni. The topic will be presented under the following headings like global and Indian scenarios, impact of COVID, reasons for stress and anxiety, what are the strategies to reduce the stress and anxiety, the action plan according to World Health Organization. In 21st century, infectious diseases are considered as a major challenge in causing death and morbidity. The novel coronavirus 19 started from Wuhan city at China in December 2019. Currently, this disease is spread all over the world. That is, more than 200 countries have been spread by coronavirus. In January 2020, WHO designated the outbreak of new coronavirus disease a public health emergency. In March 2020, World Health Organization declared the outbreak to be a pandemic with estimates of global mortality at 3.4%. These are the current scenarios, global and Indian scenarios. Globally, 16.56 crore people are infected with the corona disease, whereas 14.47 crore people are recovered by the treatment, and there have been 3.43 crore deaths, and the numbers are rising rapidly. In India, 2.58 crore people are infected, whereas 2.24 crore people are recovered from the disease, and there have been 2.87 lakhs deaths has been occurred due to corona disease, and the numbers are rising rapidly. It is a real threat throughout the world populations, mainly to healthcare workers and other frontline workers. The other frontline workers are doctors, nurses, paramedical staffs, police personnel, and the government officers. The treatment for the COVID-19 is, though there is no clear line of treatment, it is, however, effectively managed with the help of vaccines like Covishield, Covaxin, Sputnik V. That is, this vaccine will be launched in India from next week onwards. Antiviral drugs are the remdesivir, steroids, antibiotics, antiprotozoal drugs. The antiprotozoal drugs are example ivermectin, vitamin supplements like vitamin C and B complex, hydration therapy by giving IV fluids to the patients, and providing balanced diet and making them quarantine. These are the treatment strategies for the COVID treatment. What are the impact of COVID disease? So COVID disease is putting an enormous amount of pressure in each and every sector. So it has a greater impact on family life, social life, lifestyle, and economy also. So because of corona, there are many things are affected in their family, society, lifestyle changes, and economy also. So there is a sudden crisis in generating great deal of stress, anxiety, and depression throughout the world. So the current epidemic places a great demand on healthcare workers also. There is an increasing demand in the healthcare workers as well as the frontline workers also. So more than 1.6 million healthcare workers have been infected by COVID-19. Out of that, 41% of them were nurses. What is the impact of healthcare workers? There is an increasing prevalence of anxiety, depression, and stress among healthcare workers. So, in many national nursing associations of different countries have been reported that 80% of nurses suffer with mental health distress. So, recent survey by International Council for Nurses found that 64% of nurses felt work overload, and 67% of them reported difficulty in sleeping because of corona affections. The nurses are having more over workload, and they are having insomnia also. More than 20% of National Nursing Associations reported increased rate of nurses leaving the profession due to workload, fear of getting infected, discriminations, and lack of personal protective equipments. So, according to National Nurses Association, there is a the nurses are leaving from job because of workload, because nobody there, the cases are increasing, so the workload also increased to the nurses, and they have a fear that they will get infected and what will happen in future. So that, and they are discriminated, and they are not having proper professional personal protective equipments to take care of themselves also. Next, the reason for stress and anxiety among the healthcare professionals. So, what are the reasons are there for the healthcare professionals? Our first one is because of stressful work environment, because of added physical discomfort of using personal protective equipments, extra working hours, that is workload is there, apprehensions of getting infected, co-workers infections and mortalities, fear of carrying infection to family members, discrimination, family members and neighbors, increased death rate among infected patients. So these are the reasons why healthcare workers develop stress and anxiety. So the impact of stress on health, how the stress affects the health of the individual. It increases depression and anxiety, then develops burnout and post-traumatic stress disorder, reduce job satisfaction, impairs individual relationship, even lead to suicidal thoughts. Because of stress, because of the stress will affect their health. When the stress is there, automatically the person will go depression and anxiety. What will happen? They will be feeling lonely, everything, and they suddenly they will be developing a burnout, and post-traumatic disorders will be there, and they will be not having satisfaction with their jobs, and they will have no relationship with anyone because they are isolated from others. And when they are working in ward, also they will be working separately. They can't able to have contact with their friends, anybody else. So sometimes it may lead to a suicidal thoughts because of depressions. So these are the impacts of stress on health. Next, how to overcome the stress and anxiety among healthcare professionals, which can be carried out in three levels, that is individual level, administrative level, and community level. So I'll be explaining one by one. First, we'll see the what are the strategies at the individual level. So first is the individual level, having a daily routine, that is including exercise, eating, and adequate sleep. When the when the person is working in wards or whoever it may be, they need exercise properly to maintain their health, to boost their immunity level, and have a healthy food, and then adequate sleep at least 6 to 8 hours per day. The next is incorporate exercise to daily life, like improving immunity and general health and well-being. That is, this exercises plays an important role in improving the immunity and generate a health and maintain a calm mind to improve the general well-being. Next, take adequate rest and food during and after shift. And each and every shift, maybe morning shift, maybe evening shift or night shift, whatever shift is there for a healthcare workers, they should take adequate food and have a good rest also. Then they can maintain their stress and reduce the stress and anxiety. Then have adequate information and training on protocols. They that is, the healthcare workers should know about the situations and all current informations on the pandemic. They should know everything. So the institutions or the administrative level, they should provide adequate training to them. They should train in a proper usage of personal protective equipments and other precautions also. Next, maintain social contact with friends and relatives. So while they should maintain a good social contact, because technologies are more facing times, they can have a video conference, they can have a WhatsApp chatting, they can have a Google Meet, Zoom Meet, to increase their to reduce their isolation and maintain their health. Like other things also, example like online gaming, using multiplayer features, this also can be a communal feel and bonding experiences also. So maintain a social contact with friends and relatives. Next is discuss the situation with family. So it is a important for the family as well as the kids to understand the situation that the healthcare workers are facing. So it is a however the healthcare workers should also make a plan to execute in a case they come under the investigations. So next is practice yoga and meditations. Practicing yoga and meditation make the person relaxation technique, and meditations would calm their mind. So they will be physically, mentally will be healthy, as well as immunity power will improve by practicing yoga. So there are various organizations and services are provided through various platforms by doing meditations, yoga, exercise, everything. Next, communication with the co-workers to help each other. That is, co-workers face similar situations and would understand and may be able to provide solution for that. When we are working together, when we should understand each other. If my friend is getting some infections, I should help her. I should support her. If I'm isolating her, and what she will do. So always we should communicate with the co-workers and help each other. The next, maintain communication with the team leaders. That is, maintain a good communication with the team leaders with the help of resolving worries about the protocols, protective equipments, and they will be able to direct you to the psychosocial service and specific scenarios with the immunosuppression and comorbidities. If the person is having any comorbid illness or anything is there, we have to maintain good communication with them. So we can help them, we can reduce their job, we can make them support, psychological support, and we can uh, make use of the personal protective equipments, what are the protocols, everything we can follow. So that we should maintain a communication with the team leaders. Next is use psychological and psychosocial support measures. So, as a institution wise, institutions should establish a psychological hotlines and supportive services to the healthcare workers. Full advantage should be provided to the healthcare workers. All facilities should be provided to the healthcare workers. If they have any problem, if they have undergone, if they are infected, anything, we should provide them all facilities to the healthcare workers. Avoid avoid unhelpful strategies. So that is, in face of stress, people are inclined towards unhelpful coping methods such as smoking, drinking, use of drugs, everything. Not only this method is harmful for health, but they may also compromise the safety precautions to take on the risk of infections. So engage this in the religious activities. The healthcare workers also should be engaged in the religious activities. Like religious people may engage themselves in some activities they might provide. If I read, example, if I read Bible, I'll be happy, calm. I'll be happy. If I read Quran, I'll be happy. And if my mind, mental health will not disturb. So we have to engage them in the religious activities. So these are the strategies at the individual level. Second, strategies at the administrative level. So, what are the strategies the administrative level has to be provided? So, first is vaccination of all healthcare workers and frontline workers. So, at the administrative level, we have to give vaccine to the whole the healthcare workers as well as the other frontline workers also. So, provide we should always ensure that the protection with decrease the fear of infection, transmissions, and and improve the overall mental health. So when you give vaccinations, what happens? Automatically, the healthcare workers will have good information regarding everything. They will not have any fear of that infections. And when you give proper training to them, they will work in a proper manner. So that is there. And next, maintain an adequate supply of personal protective equipments and sanitizers. When you're providing proper personal protective equipments and sanitizers for the healthcare workers as well as the frontline workers, they will be not infected with the infectious disease. So they will be adequately happy and they will be willing to work in the wars in other areas also. So next, having a protocol, that is SOPs in place of healthcare workers and patients. So Mm, we should always have some SOPs, protocols for the healthcare workers. What they have to do, how they have to do, how they have to protect themselves, how to care the patients, everything. There should be some protocol which should be given to the healthcare workers as a SOP, as well as to the patient, how the patient has to behave, how they should take care by themselves, everything should be given. Next, maintain the staff roster to decrease the workload. So, as a administrative level, we have to provide adequate staffs to decrease the workload. So, the staff roster should be maintained in such a way where there is a high stress or low stress areas, where there is a more number of patients and less number of patients. If more number of patients, where you can give 10 staffs, you give 15 staff, the workload will reduce. So, like that, you have to give adequate staffs to reduce the workload. Next is the team junior staff with senior staff. That means when you're at the administrative level, we have to give senior staffs as well as the junior staffs. So when the junior staffs are there, they will learn with the senior staffs what are the things, and they will train from them and they will do better. Next is regular psychological assessment and support. So there should be a facility for a non-request psychosocial support for any healthcare workers. So the support should be provided to all the level of employees, whoever it may be. It should be provided to all the level of employees, from frontline workers to those in the managerial position also. Next, provide facilities for isolation. So healthcare workers who wish to isolate themselves from families during working in high risk environment should be provided facility for isolation. As an administrator, we should provide them isolate themselves from the families, which where the family members will not affected. So the management has to give all facilities for their isolations. And this the facilities should be extended when the healthcare workers becomes under the investigations, unfortunate contacting with the coronavirus. Next, avoid spread of rumors. That is one. Avoid spread of rumors. Only the authentic information should be passed on the healthcare workers. Unwanted messages should not be passed. The rumors, matlab, whether medias are spreading more rumors. So it should not be given to the healthcare workers. The healthcare workers should have a good training, which the government approved information should be passed to the healthcare workers according to WHO or the government schemes. Next, have a team meetings and debriefing. Team meeting is to discuss patients' outcomes, and any unfortunate event will improve the bonding with the team members and decrease the stress. When you have a team meeting, automatically there will be a good bonding with them, and the stress level will be reduced. Next is a buddy system. Buddy system is designation a workplace buddy to keep check on each other can help early detection of stress and depression. So here, with the weekly or demand reporting can help the regards of buddy system. So it can be reduce the early detection of stress and depression. So because of this buddy system, we can find the early detection of stress and depression. Next is establish psychosocial support services and helplines. So this special support and service should be there for those healthcare workers who come under the investigations and those becoming positive. So we should always give a psychological support to the healthcare workers who has become a positive or who had investigated a result positive. For them, we have to provide a psychological support and provide a helplines. Next is special consideration for healthcare workers with high risk such as immunosuppression and comorbidities. So always, as administrative level should always consider the healthcare workers who is having high risk in immunosuppression and any comorbidity disease. If anybody is suffering with hypertension, diabetes, asthma problem, we have to consider them and we have to reduce the risk of immunosuppressions. That should be there. So far we are seeing the strategies of administrative level. Next we'll see the strategies at community level. So in the community level, what are the strategies are there? First is provide adequate information about the pandemic and allay fears of the community. Always we have to give good information to the families or to the society. What is a pandemic? We should give a psychological support and we should make aware what will happen, how it will happen, so their fears will be reduced. and provide positive information to the community on the sacrifice by healthcare workers and champion for support for healthcare personnel. So always give a positive information to the community people by the healthcare workers. We should not spread any rumors or any things. Whatever the government approved informations are there, that should be provided to the community people, which will support the people. Next is we have to help them in a financial support to the healthcare institutions for proper functioning and procurement of personal protective equipments. So in the community sector, sub-center or primary health center, rural health center, whatever is there, as a community authority in institutions or administrative level, we should give a financial support to them, because to have proper functioning to help the people in the society as well as to protect the healthcare workers by the personal protective equipments. Next is prohibition of harmful activities like eviction of healthcare workers from accommodations also. Whatever, we should have some prohibitions in some activities for the healthcare workers and providing good accommodations in the communities also to take care of themselves. Avoid steps that decrease the moral of healthcare workers. So, withhold or reduce the salaries of healthcare workers, such actions would decrease the moral of overwork of healthcare workers and should be avoided. So, avoid the decrease of morals. That means reducing the salaries and keeping where there is 100 people are working, there only 50 people are working. So, half salary will be paid. So, this should not be there, because this will be decrease the moral overwork. So, they will be having not satisfied with their jobs, and they will be not happy in their job, and they will be not working properly. So that should be avoided for the healthcare workers. Then any incentives and bonus for healthcare workers should be involved in care may be decided at the administrative level. If the healthcare workers is working in a high risk areas, we should always provide them some rewards or some incentives like salaries or increments or some extra things, and giving bonus for them, which may help them to work in a satisfactory manner. So these are the three strategies in different levels: individual level, administrative level, and community level. So now, next we'll see these are the actions. These are the actions plan given by the World Health Organization to combat the stress and anxiety. So they are prepare them for the job, help them care for themselves, protect them on job, create a healthy work environment, be a good role model, encourage peer support, be perceptive and supportive, give feedback and recognitions, make services available. So I'll be explaining one by one. First is prepare themselves for job. So healthcare workers must have clear understanding of their roles and responsibilities. Okay, the healthcare workers should always understand what is their role and what is their responsibility first. They should be clearly understand what they have to do and what they should not do. Then adequate training must be provided on occupational health and safety. So as a administrative or a institutions, where it may be, they have to provide adequate training to the people according to their health as well as their safety. Like example, use of personal protective equipments and infection control measures also. Then provide technical training. So when provide technical training to perform their duties. So there should be a proper guidelines, SOPs for assessing the triaging and treating patients. How to treat the patient, how to assess the patient, and how to take care of themselves also. This technical training should be provided to the healthcare workers. This is a prepare them for the job. Second is help them care for themselves. First is provide information on stress and anxiety, how to maintain a healthy lifestyle, and when to seek further support. Always give proper information on stress and anxiety, how to maintain their health, how to maintain their lifestyles. By example, by doing meditations, yoga, doing having a good healthy food, and have adequate rest. It seeks further support. Then equip them with tools and techniques for self-care and stress management. So, as an administrative level, we should provide proper equipment, that is tools and technique, personal protective equipments to care themselves, like sanitizer also, to care themselves from, and then they will be relaxed from the stress management. If I'm providing many things to my staff, they will be happy and they will work also and they will not have any stress that I will be infected like that. Then encourage them to practice healthy coping strategies regularly. You have to always make them encourage, motivate them to have a healthy coping strategy. That is having doing regular exercise, having healthy food, taking adequate rest, okay, and having good communication, social support, communication with the team members, team leaders, everything. Next, protect them on job. How we have to protect them from the job? Provide frontline workers with sufficient personal protective equipments and infection control supplies to protect themselves from the infections. So we have to provide all the sufficient things to the healthcare workers where they will protect themselves from the infection and control the infections. Next, protect them from incidents and of harassment and violence, which including physical as well as the legal protections. So some situations are severe. There are severe situations are there nowadays. So in that cases, if I am relaxed or if I am sometimes I'll be very tired, so I'll be not working. So in that situation, they should be protected from harassment and violence also. We should give relaxation to the healthcare workers. Continuously, the healthcare workers will not work, so we should have always protect them in different ways, like harassment and violence. When we are praising them, when we are rewarding them, when we are not telling anything, automatically the person will do work. When you are harassing, when you are scolding always, the person will not do anything. So we should always protect the healthcare workers from the harassment as well as from the violence. Then protect and uphold their rights. We should acknowledge the healthcare workers' right. Whatever rights they have. If I want to have a breakfast, I can have a breakfast. If I want to take rest for 5 minutes, I can take. The rights are there. So that right should be acknowledged always. So these are the protect them on job. Next, create healthy work environment. How to create a work environment healthy? First is provide adequate staff, ensure appropriate work hours and workload, sufficient break between the shift. Always, wherever the patients are more, there you have to have adequate staffs to avoid workload and ensure appropriate working hours. If there is a shift duties are there, 6 hours, matlab 6 hours. It should not extend more than 1 or 2 hours. So like that it should be there and sufficient break between the shift because when we are healthy, then only we keep our patient healthy. So we should have a sufficient break between the shift also to have a healthy food, rest and take rest. Then consider rotating staff between high stress and low stress work areas. We should always rotate the staff, healthcare workers from the high stress areas to low stress areas. When the person is working in ICU where their patients are more, next week we can shift them to the wards where there is a less stress. So like that we have to always consider the rotating staffs between high to low level stress areas. Conduct regular team meetings. Keep update with the current guidelines. Always the team meeting will help the person to learn new things regarding that infectious disease. So always we have to conduct the regular team meeting where we want to update our knowledge as well as update and we train them and we get help from them for getting a good patient's results. Then create team building and hear their voice. That is needs and grievances. Always there should be a team building should be there. Okay, because if I'm working in a COVID ward, I'm not talking with my friends, I'm not talking with anyone, I'm alone, so I'll be feeling this one. I'll be feeling isolated. So there should be team building, team bonding should be there. So I'll be hearing my friend's voice, I'll listen some music, something that should be there. Then involve healthcare workers in decision making process also. We should also administrator as an institution wherever it is. We should always involve the healthcare workers to take a decision in proper way. Next is be good role model. We must do always first I should do, then only I can expect from the juniors or my students who are at me. So I should be a role model to my students or my juniors or to my colleagues. So adhere to health and safety guidelines. Always, whenever you're a role model, you should know what is the health and safety guidelines for the healthcare work, others. Then practice healthy coping strategies, that is adequate rest, at least 6 to 8 hours per day, balanced diet, then proper hydration, having liquids more, and physical activities. So this, when you're practicing these things, you can able to cope with all the strategies. Then avoid the use of tobacco, alcohol, and other substances. Okay, if I am using this, my juniors or my colleagues will use. So I should avoid using these all things in when we are working in a group team. Practice stress management and relaxation technique. Always you should how to cope up with the stress and how to be relaxed. This technique you have to follow. Always you have to practice. Also, always be calm. Be do exercise. Have a regular diet. Good adequate rest. Everything. Then automatically you'll be stress free and you'll be relaxed from everything. So be a good role model. Next, encourage the peer support. So, create a formal or informal platform where peers can share knowledge and provide basic psychosocial support through peer networks. So, like example, Google Meet, WhatsApp groups, okay, Zoom meeting. This can be arranged. It may be a formal or informal platforms where they can share their ideas, thoughts, everything, and where they can have a good psychological support. So, this can be provided or created to the peer group to reduce their psychosocial problems. Establish a buddy system that allows pairing of inexperienced frontline workers with their more experienced workers, thus providing professional support. That is where buddy system matlab where it is we are where the junior staffs and senior staffs where the workplace is there, seniors should be there as well as juniors should be there. So they can learn and train in a proper manner. If seniors are there, they will train us, they will teach us many things where we can learn as a junior, we can learn many things and we can give good care to the people. So that's why we need a peer support. Next, be prospective and supportive. Familiar yourself with signs and symptoms of stress and burnout. You should know yourself what are the signs and symptoms of stress and burnout. The other people who is working with you or who is your colleagues or friends, they should know what are the familiar about these symptoms. Sometimes suddenly, if some person will be have short temper, if suddenly the workload is increased, immediately they will burn out like anything. So we should know the signs and symptoms of stress and burnout. So always we should be familiar with that symptoms. Next, pay attention to frontline workers who have pre-existing physical or mental health conditions or disabilities, who are facing challenges in their personal lives and those who lack social support. So give more attention to the person who have some comorbid illnesses. So we have to give more attention to them, and when we are giving more attention to that type of people, they will have support. Okay, somebody is there to care for me, somebody is there to help me in, where there is high risk or where there is a workload. If I have workload, somebody will help me. So they will have a support. So they feel a support and perspectives on them. So always we pay attention on the co-workers who is having some comorbid illnesses. Next, give feedback and recognitions. So always give constructive feedback on their work, highlighting their good performance and opportunities to improve. So always, as an administrative level or as a individual level or as a senior, we should always appreciate to the employees who does a good work, who does a good things. For them, we have to always appreciate them or praise them. Something should be given to them. So automatically they will improve, they will be very happy and they will be doing best. Next, show appreciation for hard workers and give public recognition for their service. So here we have to always appreciate the person who is giving hard work. Like example, in our hospital, if the in-charge sister or if the senior sisters are working hard, we always give them as a certificate and cash award and give give a best nurses award, like that we provide. So like that we should always appreciate and recognize them in their services. Then provide recognitions and rewards to boost their confidence and morals. So why we have to recognize and reward should be provided? Matlab, like example, giving them incentives, some certificates of appreciation, and some increments, rewards. So what will happen? It will boost them their confidence, and they will have a good. They will remember and they will work more. So whenever, if example, if a child also, if you give on chocolate, she will study properly. Same thing, if a nurse or a healthcare workers, if you give some rewards or appreciation, automatically they feel that they want to work more. So these are the give feedbacks and recognitions. Next is make services available. So provide further mental health and psychosocial support. Always the services, what all things should be available regarding the mental health as well as the psychosocial support services should be provided to the healthcare workers. So provide psychotropic medications if they are needed. So healthcare services should be provided like any psychological problems with which has to be treated from pharmacological drugs. So if any psychological problems, anything is there for the healthcare workers, we have to provide the medications according to that to support them to get a good service from them. Next is avoid information's overload. So try to limit your exposure to media coverage as much as possible, including through social medias. So always now in a pandemic situation, we also should not expose to more media coverages, because in every channels the newses are different and they are either now and then they change the things and they tell us. So we should always include them in a social medias. Less social media should be there. So because whatever the government guidelines and the World Health Organization guidelines, that alone we have to follow. But in the media, they tell everything. Then and then the changes will be there. Now the death will be less, but they will tell more. So like that, there will be a things will information loaded on us. Because of that only we have stress more. So there should be a limited exposure to the social medias. Next is avoid source of unverified medical information and try to avoid the spread of myths and rumors. Okay, we should always avoid the unverified informations. Whatever informations are given by social medias or any persons, that should be not listened. You should avoid it. And unwantedly, they are spreading the message, unwanted messages, that is myths and rumors. So that should be avoided. Whatever the government rules, government guidelines, that alone you have to listen. So these are the action plans given by the World Health Organizations to cope up with the stress. So we have seen what are the action plans, that is prepare them for job, help them care for themselves, protect them on job, create a healthy work environment, be a good role model, encourage peer support, be respectful and supportive, give feedback and recognition, make services available. So I would like to conclude my topic. The world as a whole is faced with unprecedented situation. The healthcare workers have an important part to play to improve the situations. So, however, the solution would not be reached overnight but would take months. During this time, healthcare workers' stress and burnout has to be prevented and moral of healthcare workers has to be maintained. So measures should be taken at individual level, administrative level and community levels to maintain and improve the mental health of healthcare workers. Thank you.
Thank you, ma'am, for your wonderful explanation. You have touched all the areas. You have started with the facts and findings with the national and international statistics. And further, you have said that reasons for stress and anxiety, strategies to reduce the stress at various levels, that is individual, administrative and community levels. And you also explained the treatment protocol referred by WHO as per the guidelines. And also you mentioned about how to reduce the stress amongst the healthcare workers. That also included with the self-care measures to be taken. That those all each points were very important to know and as to follow. So that I feel like the intention of conducting this webinar and the viewers and the nursing faculty definitely will get a message how to combat with the anxiety and stress while taking care of the COVID patients. Thank you once again for accepting our invitation and being a resource person on the webinar of this day. And from Parul family, we acknowledge a wholehearted thanks to you, ma'am.
Thank you, sir. So can I begin?
Yes, 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 ma'am.
Thank you, sir.
Thank you.
Have.